This is where we reveal the truth behind plastic surgery, the people getting it, the people doing it, and the people around them. Welcome to Beauty Unveiled. I'm Dr. Angela Sturm. Today, I want to go into nasal surgery and how that can affect your overall health, your longevity, your sleep, your exercise, and absolutely your whole life. I'm seeing more and more young patients who are coming in and they're wanting to optimize their sleep. They're wanting to really feel better overall, have better energy. They're eating correctly, they're exercising, they're doing all the things that you need to do to take care of yourself, and they're noticing they're still not quite getting the optimal breathing that they would like. And so sometimes these people are snoring, sometimes these people have sleep apnea, which we can definitely, help and make better. But sometimes it's just that it's not quite optimal and they notice that they're breathing heavy, that they're waking up tired. And if you do have snoring and if you do stop breathing at night and have symptoms of sleep apnea, absolutely see a sleep specialist and they can do a sleep study. And in that case, nasal surgery can help. It usually does not completely resolve the issue, but it can definitely make your breathing more streamlined, more optimal, because we're made to breathe through our nose, and that's the most efficient way. And so if you're breathing through your mouth at night, you're not breathing very efficiently, you're not getting enough oxygen to your brain and your heart and all the important things, and so you may wake up really tired. And this can be a component of things like snoring and sleep apnea. Fixing that can either improve your snoring and your sleep apnea, or if you have pretty severe sleep apnea, that can cure settings of your CPAP lower. You're better able to tolerate it. And so that's something that I've done surgery for people doing a septoplasty, or some of the different maneuvers we do during rhinoplasty or a turbinate reduction to get their breathing more efficient. So you're able to wear the mask. It's not as much pressure and it doesn't bother you quite so much. But for most people, maybe you snore a little bit. It's not quite sleep apnea. It's not something that you necessarily need a sleep study for, or even if you've had one, maybe it's not so bad, but it's just not optimized the way that you want it to be. And nasal surgery can be a key component of that. Because like I said, if you're breathing through your mouth, it's not as efficient. Can wake up at different points of the night. There is a nasal cycle, and so a lot of people don't realize this, and they point it out after surgery once they're able to breathe through both sides and they can feel the difference and they think something's wrong. But this is the way that we're all made as humans, is you breathe through one side of your nose primarily and then switch back and forth. And the sensors for this are on your ribs and on your side, and perhaps the reasoning is to get you to move over and not lay in one spot all night. And so you'll notice whenever you roll from one side to the other that one side may open up a little bit more and the other side maybe you're not breathing through as well. This is really bothersome for people that have septal deviations, whereas one side is just physically blocked or pretty close to it and the other side is open. So if you're laying on your side where you're breathing through the open side, it's fine and you don't even think about it, you don't even notice it. But if you roll over to the side where you're breathing through the obstructed side, you may snore more, or you may wake up, or your body is going to make you move to make things better. And so that disruption of your sleep impacts the quality of your sleep, and you may wake up altogether and get up and take a little while to go back to sleep, depending on your age. That tends to happen as we have more birthdays. We know this interrupted sleep really impacts the quality of your sleep and your energy the next day. So even if you don't necessarily have things like sleep apnea and things like that, having just a simple deviated septum can really impact your rest and your energy and how you feel and your mental focus the next day. And just in general, like I said, I'm seeing these people who have a deviated septum. They're coming in, fixing the other things that may be there, like valve collapse, which is, you can feel this area where your bone ends and your cartilage begins, and this is called your internal nasal valve. So this is the narrowest part of the airway, and if it's just a couple of degrees narrower, you really feel it. You're not getting near as much air into your lungs and into your system. So just widening that even by a couple of degrees, because it's normally 10 to 15 degrees, if you can get it back to that area, it makes a huge difference in your oxygenation and your system and your sleep and how you feel. So that's another thing we can do during nasal surgery to help feel better and have better energy and just overall do better. And the other thing we can do is shrink down your turbinates. So you have 3 sets of turbinates on each side, inferior, middle, and superior. When we talk about reducing turbinates, it's always the inferior ones. They can just swell and kind of stay swollen whenever you have irritants or you have allergies, something that's making that tissue react, because this is the tissue that reacts to different things in the air. It also is what is reacting to that nasal cycle, moving your breathing from one side to the other. So if they both are artificially big and swollen, nasal cycle may move a little bit, but you may not have much space in there to actually breathe. So by shrinking those down, getting you physically more space inside your nose to breathe, when you have that shrinking and swelling from one side to the other, that is much more physiologic. You're able to get the air that you need, but then also, like I said, sometimes people notice it because they weren't breathing through their nose at all before. So we know that those interruptions to your sleep reduce the time that you're in REM sleep and reduce the time that your brain is able to reset and your body is able to reset. So by extending that time that you're in the REM sleep, your brain function can be better, your physical performance can be better, you're going to be able to work out longer and just feel better overall. And most people will do this at the same time as a rhinoplasty, because all those things we do are right there and they are in conjunction with it. And say, if you want to make it look better, like now's the perfect time. I wouldn't do all of this and then do a rhinoplasty afterwards, because some of that cartilage that I use for the rhinoplasty to get the shape the way that I want it to look may be gone if you've done things like a septoplasty. Because in the septoplasty, you're taking that cartilage that's bent and curved, and you're either taking it out or you're taking it out, reshaping it and putting it back in. So that's the perfect time to take that cartilage, shape it into what you want for the nose, and put it where you want it to be. Also, then it's just one downtime. So this is the majority of young people that I'm seeing that are coming in and saying, hey, I don't like this or that thing about my nose, the bump or the tip or whatever it is, but really I want to feel better. Really, I'm investing in myself to improve the function of my body and improve the function of my brain. And people are much more aware of this, and they're much more aware of the things that we're putting into our body and what we're eating and how we're treating it and how all these things work together. So it's really kind of an exciting time to see how people are aware of ourselves and are really taking responsibility for your health and your quality of life and longevity, and how that ties back to things that you wouldn't even think about. You wouldn't even think about all of that tying back to your nose and your breathing and maybe your smell, because your smell for me goes to quality of life because I like to eat. And so if you can smell and taste your food better, that's a nice little icing on the cake. But this is an exciting time with really people thinking about all of those aspects of their life that they can make better with a surgery that has minimal downtime. Now, if you're just doing the functional aspects, you may not even need to wear a splint. You may not even have stitches on the outside. In a few days, you're back to work. You're back to doing your normal activities. If you combine it with a rhinoplasty, it's about a week to 10 days. So a very small time away from your normal activities to be able to really engage it fully and be able to give your full everything to the things that you're doing. Let me know what other questions you have about nasal surgery, about your overall health, how everything ties together, how you can improve, your form and your function with your nose. You can find me at www.drangela.sturm.com or Beauty Unveiled, and share this episode with someone who maybe has been talking about their health and their breathing and their sleep.